Okay, so this is a follow-up meeting as far as with the doctors at the hospital. So we're going to find out exactly what's going on and go from there. Hello, Dr. Bhuvaneshwaran. Hello, can you hear me? I can't hear you. Let me see if you can unmute.
Ah, okay.
Hi, how
Now
are
I
you?
think you should be.
Hi,
I'm
how are
fine.
you?
Fine.
This is actually on my I run a show here called KneeTie. This is actually on Facebook and this is on Facebook and it's also on our live channel that we have here on YouTube and this is Zoom live. So just to let you know, because everybody here has this, especially in the ISKCON temple, they have this also. This lets everybody know what's going on real time. So can you, so your name is
Dr. Bhuvaneshwar.
Dr. Bhuvaneshwar. Nice to meet you, sir. Nice to meet you, sir. How are you?
Nice meeting you. I'm
Okay,
fine.
thank you
Thank
so
you.
much. Thank you so much for, you're the dean of the college, is that correct? Or is this,
I'm the. I'm actually. We have a dean for the medical college. I'm the
huh?
director of the hospital.
You're the
We
director
have
of the
two
hospital?
working heads.
Oh,
One
wow.
academic head and one clinical head. I'm the clinical head of the hospital.
Nice to meet you, doctor.
Nice
I'm
meeting.
pleasure to meet you. I'm Dr. Vivek Baluja. I'm working also with Vaishnav Pran and a few other doctors, and they should also be joining. And thank you for taking some time. So our patient was having headache, as you know. He gets worse during the nighttime. He has diabetes and whatnot. What are your thoughts?
See, actually, as I was telling, clinically, I'm not following him up. But what rang up in my mind is, see, these post-corona patients can have certain neurological problems, especially vascular problems, either as some sort of a thrombosis or some sort of a bleed inside. Because the headache was not a normal headache. It
Hmm.
was really troubling me because it was quite intense and behaved more like a vascular headache.
Hmm.
And so what we have done now, I think his other side, like diabetic status and the pulmonological status are all stable. So he is now meeting a neurologist. So I
Yes.
have organized the neurologist to see him, and probably we may have to do a contrast CT or something because I have a strong suspicion there is something wrong inside
Ah, yes,
his vascular.
exactly what I agree. I completely agree. We're doing a CT head, CT angio. We should do a CT head, CT angio, head and neck on him. I
Yeah,
completely
yeah. So
agree. I
yeah,
completely agree
so
with you.
yeah,
Yeah.
so the neurologist is now I have organized it to be done in the those things, and after the investigations, he would probably meet me. So I would also tell him that because he has been briefing me. His what we call a Purvashram brother
Hmm.
is a good friend of mine in Abu Dhabi,
Okay.
where I was in abroad for quite some time.
Okay.
So I know his family side. That is, his brother's wife was my junior in Stanley Medical College, where I graduated.
Oh, is that
So I met
where's
her.
Stanley? Is Stanley in Madras?
Chennai, yeah.
He's in
Where
Chennai.
you are talking from where?
I'm in Mayapur. I'm
In
in
where?
currently in Mayapur, West Bengal. West Bengal,
Okay,
Navdweep.
okay. So
Yes, yes.
somewhere in India.
Yeah, yeah. Yes,
Uh,
yes. Yeah.
but your accent says that you're
Yeah, US
uh,
born and raised. Yeah, yeah, yeah. Absolutely.
lovely. God bless you. So, because I have certain personal interest, and it so happened just before during the COVID time, I was fortunate to be a part of a Bhagavad Gita 18 days crash course
Oh,
by one
nice.
of the Swamijis, local
Hare Krishna,
Swamijis here. Hare
Hare
Krishna.
Krishna. Hare Krishna.
Hare Krishna, Hare Krishna, Hare Krishna.
Hare Krishna. How do you feel?
Yes, still headache is there, Prabhu.
Yeah, yeah. Okay. So are you seeing the neurologist?
Waiting for the neurologist. He has to come because he has gone for some rounds.
Okay. Okay. No problem. Well, so go ahead, Bhuvanesh, Dr. Bhuvaneshwar. Go ahead. Go ahead.
Uh,
So I would, as I told you, I have a professional and personal interest in him. We will do our best. We'll take care.
Mhm.
We'll keep you updated, sir. God bless you.
Okay, great. So perfect. So just tell me what's going on, and then go from there. And I guess I agree with you. CT angio, head and neck. If we believe that there's a bleed, in the brain, and then do the MRI. Don't go to the MRI first. I would say just get
No,
the
no.
CT.
See,
Yeah, yeah,
I'm not going to interfere at all because
yeah.
let the neurologist decide what he wants.
That's
I
fine.
would not interfere in
That's fine.
that. And so,
Yeah, I'm a
uh,
vascular neurologist also. So I'm a vascular
okay.
neurologist. So that's why since I've been following him all the way through. So this is the story. He was doing okay. We got his blood sugar under control and everything was okay. We gave him some prednisone because we thought it was most likely an inflammatory type headache and all this. And then the headache came down. And then after the headache came down, I didn't hear back. But then I heard that he came back with a severe headache, a severe headache again. I wasn't contacted, but then he went to the emergency department. Then at the emergency department, they just gave him a few meds, and then he came back home. He didn't get any scanning. So that's what my concern was, is that he should probably have a scan. So I think we're all on the same page.
Yeah, actually, I've been following up with him, and so after he completes his consultation with the neurologist, I will see him mostly before he leaves back.
Okay.
So I'll follow it up.
Okay. Sounds good. Sounds
Yeah,
good. So, all
he's
right.
there in
So
the hospital only. I think
is he
he's in the
going? Okay,
OPD
good.
now,
Okay.
outpatient
So
department.
it sounds good. So I think everything is good. So what we'll do is I'll just follow up with you afterwards. Okay. Okay. All right. Take care.
Hare Krishna, Hare Krishna. I'm going to the doctor now.
Good, 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 good. Do you need me online or do you want to just how about you just update me afterwards? Okay, I have another patient. You just give me
Okay,
a call. Okay?
okay, right.
Okay.
Thank you.